Okay, good morning, everyone.
Good morning.
I welcome you to the Ending the Neglect on Tropical Diseases webinar, themed Investing in the Elimination of NTDs in Nigeria by 2030, Why Nigeria Should Act Now. My name is Ebuka Ononiwu. I am a manager in the Sustainability and Climate Change practice at Deloitte. This webinar will run for 1 hour. 30 minutes, and we hope to keep to time so we can all return to our busy activities for the day and the week. For the schedule of activities for this event, we will start with a welcome note from Deloitte, then to be followed by a keynote address from the End Fund. Then we will have a panel discussion. After that, we will have a question and answer session. Then we'll round off with a closing remarks from the End Fund. So to formally kickstart the event, I welcome Bernard Orji, who leads the Sustainability and Climate Change practice at Deloitte West Africa, to give the welcome address. Over to you, Bernard.
Thank you very much, Ebuka. And good morning, distinguished ladies and gentlemen. As Ebuka said, my name is Bernard Orji. I'm a partner at Deloitte, and I oversee the sustainability and climate practice across West Africa. I am delighted to welcome you all to this online webinar on investing in the elimination of NTDs in Nigeria by 2030, why Nigeria should act now. We are gathered here today with a common goal: to identify ways to tackle the burden of neglected tropical diseases, NTDs, in Nigeria, and ultimately to recognize the roles we can play as individuals and organizations to address this issue, which will improve the health and well-being of our people. As you all may be aware, NTDs are a group of parasitic and bacterial infections that affect more than 1 billion people worldwide, primarily those living in poverty-stricken areas with limited access to clean water, sanitation, and basic health care. In Nigeria, the burden of NTDs is significant, with millions of people affected by diseases such as river blindness, lymphatic filariasis, schistosomiasis, and trachoma. Over the past few years, we have seen tremendous progress in the fight against NTDs, both globally and in Nigeria. This progress is largely due to the relentless efforts of healthcare workers, policymakers, volunteers, and NGOs such as the End Fund. Deloitte recently conducted a study for the End Fund on the cost-benefit analysis of eliminating NTDs by 2030. Our analysis showed that the Nigerian economy will gain about $18.9 billion from its citizens' increased productivity from 2023 to 2030 if the elimination of NTDs is achieved by 2030. Now, these gains are beyond economic benefits, as the social lives of the affected people will be improved, as they can lead more productive and fulfilling lives when they are cured. Today's webinar provides an excellent opportunity to elaborate on the progress so far and to explore new ways to end the prevalence of NTDs in Nigeria. We have an outstanding speaker and a lineup of panelists, which includes experts in the field, policymakers, medical researchers, NGOs, and private organization leaders, who will share their experiences and insights on how this goal can be achieved through collective efforts. Through this section, we hope to gain a better understanding of the challenges faced, as well as the opportunities and strategies available to tackle NTDs in Nigeria. In conclusion, I would like to thank our keynote speaker and panelists for their willingness to share their knowledge and expertise with us. And I would also like to express my gratitude to all of you for joining us today. I hope that you find this webinar informative, engaging, and fruitful. and that inspires us all to work towards a future where NTDs are no longer a burden to the people of Nigeria. Thank you very much and welcome once again.
Thank you very much, Bernard Oji, for that welcome address. And to get things rolling, we will invite Professor Moses Bokari to give a keynote address. Prof is a board member of the End Fund and professor of neglected tropical diseases. Currently, Prof is the regional director at the European and Developing Countries Clinical Trials Partnerships. Prof has actively participated in many efforts aimed at addressing neglected diseases for more than 30 years. Prof, you have the floor. Professor Moses, are you with us? You need to unmute.
Hello, can you hear me?
Yes, we can.
And can you see me as well?
Yes, we can.
Okay, good, because I was just playing with my gadget, a few things went haywire, but I'm really delighted to be talking to you today. So I am speaking from Freetown, Sierra Leone, and I arrived here last week from South Africa. And I'm glad, as you rightly introduced me, I am speaking today in my capacity as a board member of the End Fund. But I wear lots of other hats that makes this webinar very interesting for me. And I have engaged Nigeria in my previous roles. So I was professor of neglected tropical diseases in the Liverpool School of Tropical Medicine for many years. And while I was there, I engaged quite a few people, including Frank and Elizabeth, on activities to do with neglected tropical diseases. Now, last week, I participated in the WHO NTD department webinar, GON webinar. So GON is the Global Onchocerciasis Network for Elimination. And it attracts a lot of people. And a few weeks ago, Nigeria also presented their case for how they are progressing towards eliminating onchocerciasis by 2030. So it's really very interesting for me that just after my presentation, because I, in Sierra Leone, I'm also chair of the Technical Advisory Committee for the National Neglected Tropical Disease Program, which also acts as the National Onchocerciasis Elimination Committee. Now, during the GON webinar for Sierra Leone, which was more than 100 people participated in that, I gave the presentation on how well Sierra Leone is progressing. And after that presentation, I had one important question, and it came from somebody who's been in the business for a long time. Tony Uketi from DRC. Tony used to be in Geneva, WHO Geneva, leading the NGO network for onchocerciasis, and he asked the people, so, okay, some of the challenges you have cited includes getting support for further activities. What are you doing to try and get domestic funding from your country? I think, so this is very pertinent to what we're discussing today. And other participants in that webinar included the program coordinator from Nigeria and the program coordinator from Guinea. And Guinea, Sierra Leone, and Liberia could not really present a question. So a lot of countries in Africa have this challenge. So it is really very encouraging that Nigeria now has a platform where this is an important topic, and Nigeria has the experience to move us forward in doing this, because as the country with the highest burden of NTDs in Africa, and having successfully eradicated guinea worm, and having successfully engaged very important people in the country during the eradication of guinea worm, another NTD. I remember that General Yakubu Gowon was very, very passionate about it, highly involved. And I'm also aware of with the sort of local NGOs like Francas, the effort they've been making to ensure that there is efforts from Nigeria to ensure that whatever gains they have are sustainable. So this is really critical. And I think we all benefit from the fact that usually the story, as the story I told you from Sierra Leone, is that, well, the government is not giving us money and we all depend on our implementing partners, and it has been a struggle. There's no budget line. But we now know that there are countries like Rwanda where the government is completely funding NTD programs. So I think this is really a challenge on a continent where, for instance, we consider Nigeria as the super country. I mean, I wanted to say big brother, but I am not sure how accurate in terms of political correctness that will be. But I think with Rwanda doing that, I can see Nigeria actually now seeing, because it's just seeing the effort that this can happen. And I think we're having this discussion now at a time where we've had we had the COVID experience, and because of the experience with Ebola in West Africa, Africa CDC was formed. So we now have a voice for public health in the African Union office in Addis Ababa that coordinates this. And we should be really encouraged by what has been achieved recently. I mean, during the COVID pandemic, when a lot of countries manufacturing vaccines could not prioritize Africa. I mean, African banks came together, African institutions, African heads of state came together. They were able to garner funds and explain why it is important for Africa not to beg anymore, but to actually facilitate this. And they actually were saying to the manufacturers of vaccine, we are not asking for anybody to donate anything for us. We just want a fair price. We've got the money. We will pay for it. I think this is what we want to be able to do as we begin to talk about putting together our domestic resources so that we can ensure that we are all moving forward. So I really look forward to these deliberations and to the panelists who've got a lot of experience in what is happening here. And we hope that after Rwanda, we can also see Nigeria, which has also got a lot of experience and made a lot of gains, also coming forward to see, to try and demonstrate how the efforts they are making and how domestic initiatives are promoting this so that we can sustain the efforts we have. Thank you very much.
Thank you very much, Prof. Moses Okarie, for that keynote address. As expected from a professor, it was partly a class in public health, political history, and all of that. So thank you very much. We appreciate your knowledge and insights to the event. So we will proceed to the next discussion. And please, I would like to mention that if you have questions for Prof during the question and answer session that we would have right after the panel discussions, you can bring up those questions, and I'm sure Prof will be glad to respond to them. So for the next activity of the day, is the panel discussion, and we have 5 distinguished panelists. I'll quickly introduce them and we'll move right into the session. The first is Professor Fabian Olaoluwa Akinwole. Prof is an expert in parasitology. She is the director of NTDs research, as well as the head of the Molecular Parasitology Research Laboratory at the Nigerian Institute of Medical Research. Professor Fabian is also a member of multiple NTD research groups. The next is Dr. Francisca Olamiju. Dr. Franca is the executive director of Mission to Save the Helpless, MITOSAT, an NGO that fosters interest in and directs the focus of development assistance towards issues affecting rural dwellers, especially those relating to NTDs. We also have on the panel today, Dr. Elizabeth El Hassan. Dr. Dr. El Hassan has decades of experience in public health research, NTDs, and eye health. She has working experience across all regions in Africa, serving many experts committee as well. She was the former country director for Sight Savers Nigeria and the regional director for Sight Savers West Africa. Thank you for joining us, Doctor. And we also have Asmao Smaila. Maybe you become a doctor very soon. So Asmao is an associate director of sustainability and corporate communications at IHS. She has over 19 years of experience spanning public service, oil and gas, and telecommunication space. Asmao has diverse backgrounds ranging from business administration, human resource, public relations, communications, sustainability, and many others. And Asmao represents a very key community, which is the private sector in this session today. And we have Dr. Akpan Nseobong, who is the National Coordinator for NTDs at the Federal Ministry of Health, Nigeria. He oversees all NTD efforts across the regions and states of Nigeria. Dr. Akpan, thank you very much for taking out time from your very busy schedule to join the session. Okay, Dr. Akpan, can I confirm that we can proceed? Hi, Dr. Akpan. Okay, so I think Dr. Akpan is having a few challenges. We'll move right into it. I'm sure he will join us shortly. So I'll start with Professor Fabian. Prof, you had a very critical agency involved in medical research. And so we'd like to know, how can local manufacturing of NTD treatment drugs enhance the elimination of NTDs in Nigeria? And are there any progress so far based on the research and the work that you do at NIMR? Prof, you are muted, please.
Thank you very much, Ebuka. I'm very happy to be here this morning. And good morning again to other panelists. Good morning, my senior colleague, Dr. El Hassan, and Dr. Francisca, and others. Yes, local manufacturing of NTD treatment drugs will enhance elimination and help the country to be able to hit the targets, the elimination target by 2030. There are so many advantages if we could produce the NTD drugs locally, because one, the most important one is it will ensure reliable and timely access to treatment. It will also alleviate the problems of shortages and stockouts, and to shorten the supply chain. And then generally it will promote technology transfer and build capacity. But as it is, I don't think that we are manufacturing NTD drugs locally in Nigeria, even though other countries like developing countries such as ours, like Brazil, India, China, are producing the NTD drugs locally, generic ones, for both local and international interventions. But I think that Nigeria can also do that because of the advantages that I have mentioned. So I cannot say we are making progress in this area. And mind you, treatment is not just one intervention for elimination of NTDs. The WHO recommended 5 public health interventions, and large-scale preventive chemotherapy is just one. Others are the safe drinking water, sanitation, hygiene, wash. Then we have integrated vector management. We have veterinary public health. We have innovative and intensified management, because there are some entities that you cannot apply MDA, mass drug administration, to control. For example, borreliosa, you treat patients for 8 weeks, placing them on rifampicin and streptomycin that are antibiotics. So you cannot apply MDA to control borreliosa. Otherwise, you risk resistance, which is a global challenge now, antimicrobial resistance. So these public health interventions, they cut across sectors, and one cannot work in isolation towards achieving elimination by 2030. So these 5 have to work together to be able to achieve, but producing these drugs locally will also enhance and quicken our achievements of the targets by 2030. Thank you very much.
Thank you very much, Prof. So we'll move to Dr. Elizabeth El Hassan. And I think this question is very similar to some of the points that Prof has raised. Based on your work around the NTDs, apart from investing in the provision of drugs, what other factors require funding to ensure that NTDs are completely eliminated? I would also like to mention that please, each of the panelists should keep their responses to the timeline of 3 minutes. Thank you very much. Over to you, Dr. El Hassan.
Yes, thank you very much. It's a pleasure being on this webinar. Besides the drugs issue, there are many other issues that would need, factors that would need to be addressed if we have to eliminate by 2030. For instance, scaling up interventions that needs to be taken on head on, and also sustaining geographic and therapeutic coverages over time, because it's not just attaining the coverages in 1 or 2 years, but over the required duration of treatment. We also need to look at the water and sanitation sector and what is required, the intersectoral collaboration, because the four or five of the major top NTDs in Nigeria would benefit from improved water and sanitation. The other factor is the behavioral change. The water might be there, but are people using the water? The sanitation might be available partly. What are people doing? So it requires funding for you to change behavior. There's also capacity building of the healthcare workers, particularly for river blindness at the top level. Entomology technicians that would need to be trained. There's also provision of technology for elimination, to confirm elimination. Some diseases are, more rigid than the others in terms of what is required. And then there's also monitoring and supervision, monitoring and evaluation and surveillance. So funding is required for all of these activities I have mentioned. Thank you.
Thank you so much, Dr. El Hassan. Riding on that, I'll go to the private sector, Asmau Smaila. Asmau, how do you think investment in the NTDs elimination in Nigeria yield a positive return on investment? And what are some of the tangible benefits of such investment? And this question is thrown at you because your organization, IHS, has done some work in WASH and the NTDs.
Great, thank you, Ebuka. Hello, everyone. So these investments in neglected tropical diseases, elimination in Nigeria can definitely yield multiple results, positive return on investment in multiple ways. First, when we eliminate these NTDs, it can lead to significant cost savings. I think someone needs to mute.
Dr. Akpan, please can you mute?
MMDP WASH. Which other one? Okay.
Okay, thank you. So first off, I mentioned it can lead to significant cost savings for the healthcare system. Most times these NTDs come with long-term treatment and care. There's a huge burden which can be costly, especially for people living below the pyramid. So, and there are loads of people too living in poverty. So they may not have the financial means to cover these expenses. By eliminating NTDs, the healthcare system can now redirect the resources towards other healthcare priorities, which are many. Secondly, there will be improved productivity and economic growth, and it's shown clearly in the Deloitte report. These NTDs can cause chronic disability and disfigurement, leading to reduced productivity and increased poverty. By eliminating NTDs, individuals can either return to work, students go to school, thereby contributing to economic growth and development. In a nutshell, children are learning, adults are earning, and collectively we thrive. Thirdly, there's going to be improved quality of life for individuals and communities, because as discussed, it's a huge burden. They can cause physical pain, mental distress, and a whole lot more, generally negatively affecting the well-being and ability to participate fully in society. By eliminating these NTDs, individuals can live healthier lives, thus contributing to their community's social and economic well-being. Lastly, it can also contribute to achieving the United Nations Sustainable Development Goals. Specifically, eliminating NTDs while directly focused on SDG 3, that's good health and well-being. But when you dig down, it also mentions in SDG 3.3 that's specifically directing at ending epidemic of NTDs by 2030. It has a significant implication because it has a correlation with other SDGs. 1, poverty, 2, hunger, 4, quality education, and more. It also is directly correlated to SDG 5, which is gender equality, SDG 6, which we're talking about wash, share, clean water and sanitation, and also SDG 8, decent work and economic growth. That's why I mentioned children learning, adults earning, and collectively we thrive. So basically, when we look at all these ways, there's several other ways, but it's definitely going to be a very positive ripple effect, I must say. Thank you.
Thank you very much, Asmao. Key points that you noted are increased productivity, as well as channeling of resources to other medical emergencies aside the NTDs. Wonderful submission from you. So we'll move to Dr. Franca Olamiju. Dr. Franca, from your perspective in running an NGO focused on eliminating NTDs, what are the factors that should be prioritized or can be limiting factors to eliminating of NTDs in Nigeria?
Thank you. Thank you for having me here. And I appreciate the fact that I'm speaking with other knowledgeable people in this field. Yeah, first of all, I would say the awareness on NTD is still very low. And I'll give an example. If you talk with your family members today, your children, grandchildren, other colleagues that are not really staff of NTD by one way or the other, you can take that test and see what they tell you about neglected tropical diseases. The knowledge is still very, very low. So I think we are missing on awareness. We need to create awareness. There are other publications that shows that awareness on NTD needs to improve. You can go to the street and ask people, do you know what is called neglected tropical disease? Do you know the diseases? You know, just try it. You will see the response, and it will be the same, that the awareness is low. So it is important that people know. You know, we're talking about investment to be able to eliminate NTDs. It's not just about money. If everybody that should know about NTDs are aware, then we are the space where we can get support. Dr. Hassan talked about WASH, and other panelists that spoke before me talked about assessment, molecular, laboratory provisions. A lot of things has been said here. And people can actually lend that to the NTD community without really giving them physical cash. But if they are not aware, they can't do that. So I think we need to create that awareness. We have hard to reach area We have people in the aviation industry that are willing to help us, get helicopters to deliver drugs to these people. But if they are not aware, it will be difficult to lend that support. And remember, NTD has locked a lot of us, a lot of Nigerians, a lot of people in the impoverished communities into this circle of poverty. But why do we have the hurdle? Because those that should know are not aware, and it still remain neglected. So we need to create that awareness. That's the key one I can speak about now. Thank you.
Thank you very much, Dr. Franca. Awareness, very critical, and it should be invested in as well. So we'll go to Dr. Nsebong Akpan. Dr. Akpan, are you with us? Thank you very much, sir. You may want to unmute your mic. Okay, so Dr. Akpan, what specific investments or interventions have been implemented in Nigeria to accelerate the elimination of NTDs? And what impact have they had so far? I mean, coming from the government perspective.
Thank you so much. I think, first of all, I need to tender apology for not joining you on time. I'm within the southern part of the country, and I was having a lot of challenge as regards to issue of network. Good enough, I've been able to join the session, so I have to apologize for late joining. Along the line, I'm still opportune to hear from other speakers to some extent. Talking about what the country have been able to do so far to see how we can drive toward sustaining an impact and eliminate NTD in Nigeria, we have so far done a lot. Quite well in Nigeria, we have about 4 or 5 levels of intervention strategy. And you know that somebody was talking about WASH. We also have issue of mass administration of drugs. We have the vector control. We have the mobility and stability management. Then we also have the innovative or intensified case management. Now, having deployed that about 5 strategy to see how we can eliminate NTD in Nigeria, the government did not relent in the effort to ensure that we sustain the gain and work toward making an impact toward economic drive in eliminating NTD in Nigeria, because a greater number of populations have been infected. Just like the last speaker says, if awareness is not much created, then it will still end up the same way. Definitely in Nigeria, you knew quite well that we had a lot of awareness as far as it comes to malaria, TB, and HIV, but what's happening in NTD become an issue. The government have already invested a lot to sustain this program for economic purposes, because we really want to bring out a lot of Nigerians out of neglected tropical diseases. Along the line, government have been able to contribute towards the NTD eliminations. We have been involving the private sector to ensure that we sustain this gain. Currently, we involve the National Assembly, at least because one of the key things there is to ensure that the policymakers drive towards elimination of NTD. You look at it that once the national takes up this program, we've been able to make progress. So the National Assembly, some time ago last year, joined the Senate Committee on Health, joined in ensuring that we work toward elimination. We work toward bringing in resources. We have a private sector like the Abdul Rahman Foundation, the Danjuma Foundation, and also the Gawar Foundation that have been supporting, working toward them. Government in its part ensure that we work toward bringing in this time around community involvement. So it's not a matter of government alone. The community have been sensitized to be involved. Then the states also have a role to play by contributing their own budgets, because initially it used to be government, federal government affairs alone. So the state government, the LGAs, have been sensitized and they are contributing their own quota toward the elimination. Then we did not end up there. We ensure that the community take up, especially the issue of wash. It shouldn't be government affairs. It should be community that participation in the wash drive. Having done that, then the government now said, look, we need to develop what we have, one health approach system, whereby we can integrate all our programs. Malaria can work with NTD, TB can work with NTD, and so on and so forth. So we do what we call health integration, using one health approach system to see how we can be able to eliminate NTD. If I want to give you the breakdown of the statistics so far, we have been able to reduce the burden of onchocerciasis in the country. The level of diseases have been reduced. A lot of LDAs have been able to cover, whereby we have even suspended the issue of mass administration of medicines in so many LDAs. The issue of trachoma in Nigeria has gone to a stage that very soon we'll be talking about pre-elimination of trachoma, and also in onchocerciasis, we have been able to eliminate in 1 or 2 states. Then while other states are working towards suspension of medicine administration in those AGA. So in general, you look at it, that the government have been able to sustain a lot of gains, and we're still trying to ensure that we deploy a lot of so many interventions and some innovative practices, calling on the private sector to beef up more to ensure that we really gain much in elimination of this disease in the country. That is why we are now working toward having a strong private sector collaboration with the government and strong sensitization and mass mobilization of Nigerians toward elimination of this disease at the community level. So we are not focusing at state level again. Our issue is driving toward what level implementation to ensure that every communities, every nooks and crannies of the country is well covered. The idea is for us to meet up with the global target of 2030 as stated by the WHO. So that is what the government is trying to do to ensure that we sustain a lot of gain. We're deploying a lot of manpower, a lot of resources from private, from government, and ensure that we increase budgetary allocation at all tiers of government toward elimination of NTD. That is one of the things that government is working toward, elimination of NTD. And we have been able to achieve a lot. So within a short time, if we go by this level, I can bet you that Nigeria between now to 2030, the next 6 years, in some of these diseases, we'll be telling you that we are almost at either elimination stage or pre-elimination stage. So that is where the government is really working toward. And we're very comfortable that our partners collaborate with us effectively. Thank you.
Thank you very much, Dr. Akpan. I see that quite a lot is happening. Like you stated, it needs to gain more awareness. You need to also take it down from state level to the world level. So from there, we'll move on again to Dr. El Hassan. And the question for you, Doctor, is what lessons can be learned from successful NTD elimination programs in other countries? And how can these lessons be applied in Nigeria? This is given by the fact that you have worked across every major region in Africa.
Thank you very much, Ebuka, for your question. The first point I'd like to make is the importance of intersectoral collaboration. That is key. Because with NTDs, we've talked about the need to improve on awareness creation and the need for behavioral change and the need for improved water and sanitation. It's not something the Ministry of Health alone can do. Other sectors need to be involved. Those providing water, those creating awareness like the media, the national orientation agency can be involved. We also have to look at integration. In other countries, they have tried a tool for monitoring of onchocerciasis, river blindness, and lymphatic filariasis together. Once this is approved by WHO, these can be applied in Nigeria. There's also the issue of changing the frequency of treatment for river blindness. In the Americas, they tried annual, didn't quite work. They had to move to semi-annual. They had to, when they had challenges with hotspots, they had to move to thrice a year treatment and then quarterly treatment. Nigeria's done well. 9 states have interrupted transmission in the country, but there are still states that need to, move ahead for we to be able to attain the WHO timelines. That means that we have to be flexible with our frequency of treatment. If semi-annual does not work, we can look at treating thrice a year or quarterly. So those are the 3 points I'd like to bring up. Thank you.
Thank you very much for the wonderful insights from other clients. So I'll go again to the private sector, Asmao. And Asmao, IHS is committed to promoting good wash and to tackling open defecation, which is closely related and linked to NTDs, right? Can you shed some light on the synergies between these and the NTDs, and why other private sector organizations should have a holistic approach to improving on public health outcomes in Nigeria?
Thank you. So for us at IHS, it is pertinent that we impact the communities we operate in and ensure they thrive. We operate in 11 markets, but Nigeria is our biggest market, which means we operate in almost every community in every state, including the FCT. So given the alarming and disturbing statistics and Nigeria's current top ranking in open defecation, this is a clear and present danger that needs to be tackled. So for us at IHS, it's not just being reactive because it's already happening, it's also being proactive, and it's the next logical step to take to ensure it's sustainable, it's practical, and it's effective, and also ensure we impact a wider reach of people in Nigeria. So there's several linkages between WASH and NTDs, and I'll just share by giving examples. One is, among strategies for eliminating trachoma in the long term, effective and accessible WASH services are critical. Improved sanitation is the primary prevention strategy for intestinal worm infections. These infections can lead to undernutrition, poor performance, and death. I remember an example I read from one of the NFON reports. It's from a mother in Burundi. She says they had the epidemic of snake worms, or snakes in the bellies. That's what they call them, snakes in the bellies. She lost her first child and lost a second child 4 years later. But now that it's being treated and on the road to elimination, there are no longer snakes in the bellies and they're thriving. So some of these NTDs actually need rigorous personal hygiene at the same time to manage and treat. As such, WASH facilities are required, and here is where we come in by making huge investments in WASH facilities and more. Then taking a holistic approach, it can be one prong, of course, no doubt. All SDGs, like I mentioned earlier, are interlinked, integrated, and support one another. Access to water, sanitation, and hygiene is the core and foundation towards health, equity, equality, gender equality, and education. By prevention of these, we ensure the greatest relevance for SDG 3, where it explicitly calls for ending NTDs by 2030. So by taking this holistic approach, clearly it is necessary that it is inextricably linked, as I mentioned earlier, but almost all the development areas covered by SDGs are also linked to what's the current subject. So tackling SDGs is fundamental to ending the cycle of poverty, SDG 1, and a whole lot more that I mentioned earlier. So some of these strategies, such as mass administration of medicine, which the N Fund is pushing, and where one of the private sectors working with them. Also, integration of these WASH activities covers SDG 6, that's clean water and hygiene. And why is IHS right here really having a seat at this table? There's no prizes for guessing. The private sector has a crucial role to play in the realization of SDG 17 partnerships. So all these SDGs are driven by effective partnerships to ensure that SDGs come to reality. Thank you.
Okay, thank you so much, Asmao. And I'm sure your submission would inspire other private sectors in the room to take a step and act towards the elimination of NTDs. So I'll go to Dr. Franca. Dr. Franca, how can we ensure that NTD elimination efforts in Nigeria are sustainable in the long term? So we don't have a situation where pre-elimination is declared or elimination is declared and somehow there's a relapse, right? So what strategies can be used to ensure that gains are not lost?
Thank you very much. Again, I'll continue from the point that Asma mentioned, that we need to continue with mass drug administration. Many thanks to the N Fund and other donors that are helping us to make sure Nigerians are treated and elsewhere in Africa and beyond. As you know, 165 million Nigerians require one form of NTD drug or the other. So if we don't do anything about it, what happens to them? And why are they neglected? When you talk about neglect, that means we could have done something about it. So when I think about sustainability as an NGO partner, the government alone cannot do it. It's a burden, and it's locked a lot of us, Nigerians, a lot of people in our communities in this circle of poverty. So when you talk about sustainability, we need to invest. And I'm very grateful to Deloitte and the N Fund and others that put this together, because we really need to let people know we are burdened by his disease. So, and the government alone cannot do it. We need to lift this burden first. We need to lift that burden off the shoulders of our people. And how do you do that? You have to invest on treatment, making sure people get this drug, making sure when these drugs arrive at the port, they are not delayed for months and they expire there. Who is in charge here? The government of the country is in charge. What sustainability do we know there? We need to make sure these drugs are cleared on time. Are they aware? The officer in charge, does he know about NTD? If he knows about the NTD and the importance of getting this drug to the community, he wouldn't let that drug stay a day longer than it should be. That's sustainability. We need to let these people know. The education sector, I don't know how many of our children are aware of these diseases. Sustainability is about teaching them from nursery school, the one they can understand. They have comic books. How many of our comic book captures NTD? So the education sector should be there sustaining. But above all, Ebuka, I will say that let's leave this sustainability when we have relieved this burden. Of course, we'll carry the government along, we'll be sustaining along, but it's easier to sustain when we have eliminated. Control has been achieved, but elimination is what we're pushing for, so that at the point where we have relieved this burden of our people, the government can sustain by making sure surveillance is in place, monitoring tools are used, and we continue to make sure there's no recrudescence. But right now, all hands need to be on deck, because the burden, yes, a lot of effort has been made by, as narrated by Dr. Akpan, but there's still a whole lot to do. And that's why I believe Oyetola and the rest of our team are screaming, we need to invest and take people out of this lock of poverty. Thank you very much.
Thank you so much, Dr. Franca, for the passionate submission. And I like the angle of drugs that you brought up about drugs being cleared on time and all of that. Wonderful. So I will go to the last round of questions to all the panelists, and I'll start with Professor Fabian before I'll go on to Dr. Akpan. So Prof, as a critical voice within the NTD space, do you think more funding is needed in the area of NTD research? Or do you think Nigeria is at a point where mass drug administration is what is largely needed?
Thank you, Ebuka. Yes, we need increased funding, not only from the government, but also from the private sector through public-private partnership. Increased funding is necessary for more research to provide the much needed evidence to support interventions, especially in the areas of drug discovery and development, vaccine production, drug resistance, new diagnostic tools, case management, and clinical trials. I said drug development, drug discovery and development. And this involves so much funding, is capital intensive because there are different stages. You first discover the molecules before you develop the drug. And when you develop the drug, there are stages you take the drug through before it gets to the end users. You need to do different stages of clinical trials to ensure efficacy and safety of the drug before it gets to the end user. So a lot of research goes into this and funding is needed. As you asked if Nigeria has come to a point where MDA is the only intervention that is largely needed, I would say no. Like I mentioned earlier, WHO recommended 5 public health interventions that must work together holistically, not just one working in isolation to achieve the targets by 2030. And mind you, 2030 is around the corner. We're already in 2023. But elimination is achievable. Like, take Togo, for example. Togo is a small country, not as rich as Nigeria, and is the only country that has eliminated 4 NTDs. Lymphatic filariasis, dracunculiasis, otherwise known as Guinea worm, trypanosomiasis, that is a sleeping sickness, and more recently, towards the end of last year, trachoma. So if Togo could achieve this, Nigeria could do much more. And I don't think MDA on a large scale is the only thing that we need. There are some diseases, like I mentioned earlier, Buruli ulcer, that you cannot adopt MDA. Otherwise, you risk antimicrobial resistance, which is a global challenge for now. And even we still need research into other drugs that could be used, maybe repurposed, because we depend on, for example, schistosomiasis, we're using praziquantel. And we may begin to see resistance in the field. So what do? We rely only on one medication. So MDA to me is not what Nigeria needs now to achieve elimination. Other sectors and other public health interventions must come to play and work hand in hand, such that we'll be able to meet the global targets. And these public health interventions, for emphasis, we have the large scale preventive treatments, safe drinking water, sanitation and hygiene, that is WASH, integrated vector management, veterinary public health, and innovative and intensified disease management. All these are needed. So not only MDA. Thank you very much.
Thank you so much, Prof. So we'll go on to Dr. Akpan. The final question for Dr. Akpan. Please, I would humbly request that you keep it to between 2 to 3 minutes. Keep your responses to between 2 to 3 minutes. So in what ways can the Nigerian government support public health financing to increase the funds available for the treatment of the affected people and elimination of NTDs?
Thank you so much. As government, we talk more. Bear with me on that. Actually, government of the day have a lot to do when it comes to financing public health. But before I dwell on that, let me lend my voice a little to the last response that Luka said. You see, for sustainability in Nigeria, we need one, strong collaboration. Within the program, with the MDAs, we need a strong integration and also we need strong private sector, we need strong community participation. Those are the key things. Now, on financing public health, the government has a lot of things to do. First of all, if you look at it, there's nothing wrong if NTD is covered under health insurance. We don't have NTD under health insurance. And it's one of the challenges that government is working toward, ensuring that NTD goes under insurance. Then we also have an issue with the increasing budgetary allocation. In the past, NTD was highly neglected, but today we can say that the government is coming up effectively trying to locate some huge resources to NTD. So we are investing to ensure that it's not only a private sector alone, it's not only donors or partners, the government is increasing budget allocation. That is why we also involve the states. Many states have budget allocations, many local government have budget allocation for NTD today. Some of the allocation is being tied to WASH program, some goes directly to the NTD. So government is investing there in that direction. We also have an issue where we are now ensuring that corporate organizations are involved. Like I rightly mentioned about the most of the funders, the Rabi Foundation and others in there, they are involved a lot. So government is financing this. And the only key challenge that we are still struggling with government to increase funding is to ensure that tax revenue that we're getting from the tax should also be allocated to NTD as well, so that more and more research should come up, because we really need to do more research, especially to unravel some innovative practices toward elimination of NTD in Nigeria. So you can now see that this is the area that the government is working toward, and that brings the government to the idea of, in order to sustain the program and save costs for economic purposes, we need to go into one health approach system. We need to integrate some programs, like malaria was operating in isolation, when NTD is supposed to work hand in hand with malaria, collaborate with TB, and so on and so forth. So financing public health now has become a key issue to the government of the day by increasing the budget allocation, bringing in private sector to buy into it and increase their funding as well. And also, we are working currently as a government to ensure that most of the diseases in NTD is now to enroll under health insurance scheme. And very soon, you get that response, because it's one of the things that we have been deliberating on. That is the situation of government of the day. So government is already working toward that. And that is why we have to ensure that the National Assembly is already responding toward this direction. We under the health policy, we are trying to be sure that NTD comes after the 3 diseases I talk about. NTD comes as number 4. So there's a program on the way to ensure that we have insurance for NTD program as well in Nigeria. It's not only in other diseases alone. NTD should be, because if you look at it critically, the disease is for the downtrodden, it's for the poor. They are here in the shanties and slums. How do we bring them out from this environment? So government is working toward increasing more and more budget allocation and ensure that they are covered up. Then revenue should also be derived toward sustaining this program. That's the situation of government of the day. That's it for now. Thank you.
Thank you very much, Dr. Akpan. Hopefully, some of these plans will come on board as soon as possible. I like the idea of including NTDs as part of insurance packages or HMOs. Okay, so we'll move on to Dr. Franca. The final question, please try to keep it within 2 to 3 minutes. How can community engagement and awareness raising, and I know you've spoken elaborately on this already, but how can community engagement and awareness raising campaigns be effectively leveraged to support NTD elimination efforts in Nigeria?
Thank you very much, Ebuka. I would say the awareness raising, I will ask each and every one of us to do something. Talk about awareness creation within your space today. Talk to someone, check on them, know whether they know about NTDs or not. Then we need community engagement. Every community have a leader. We have leaders in every community. And I to share a joke, I said, if a tree should fall and block the entrance to a community, within minutes, that tree will have to be removed. Community will mobilize. There's no community without a leader. So we need to network into the leadership, community leadership structure we have in Africa to be able to eliminate diseases. Let's engage them the more. We can use social media, yes. Once everybody is, on one social media platform or the other, let's make the message simple. Let's put it out there. Let's track it. Let's really know what's the baseline today. I'm sure you can do that. And then in about 3-4 months, let's come back and say, what have we done well? Have we put the message out? Has it been taken? And our communities as well. Community leaders, they go to market, so there's no community without a market day. They have market days. Let's go to the market. Let's go to their local market. Let's take the market there and sell it. And I believe it's only when we engage our communities that we can sustain our efforts and eliminate these diseases, especially these ones that are really, really impoverishing us. Thank you.
Thank you very much, Dr. Franca. And I'll try to take up your challenge and speak to 1 or 2 persons myself about NTDs and just ask them basic questions to see where they are at. So we'll move on to Dr. El Hassan. Final question for you. Please keep it short so we can take questions. I can see a couple of questions already on the chat box. How can Nigeria leverage the use of technology and innovation to support the elimination of NTDs? And what role can private sector players play in this regard?
Thank you very much. In terms of technology, the first point I'd like to raise is technology in terms of modeling for elimination of various NTDs. Nigeria can work with modelers in this aspect. And I'll quickly bring in the private sector there. The private sector can support universities and departments that are active in this. Provide funding to them so that they can work with the Ministry of Health and with partners in the various interventions. The other thing I'd like to mention is the district health information system, which has been used in many countries. Nigeria is active in that and is using it for other interventions. NTD needs to catch up fast with that and scale up, because this provides information, real-time information that you can use for informed decision making. You don't have to wait till the end of the year to know you have not treated a community for the last 1 or 2 years. That information is available to you and you can take action immediately. The other thing is that there's a lot of research that's on new diagnostics and technology. The private sector can also provide funding for this. And in almost all the issues we have talked about, there's also the innovation of community-directed water and sanitation. Trying this and getting the communities to be very active in it may require some level of funding, so the private sector can be involved in that. Once the communities buy into it, it becomes theirs, ownership is better, they don't have to be chased to clean their communities up. They will do that as part of the norm for that community. Thank you.
Thank you so much, Doctor. And lastly, Asmao, how can the private sector work with the Nigerian government and other stakeholders to create supportive policy environment for NTD elimination efforts?
Thank you, Ebuka. Thank you, everyone. So yes, I'll mention some steps based on experience and what I just have engaged in, all thanks to the partnership with the NFON. However, listening into Dr. Francisca and all the other erudite panelists gave me this balcony approach where I've left the floor now. I'm on the balcony watching and learning and seeing different perspectives. So thank you, everyone.
Hello.
Hello, can you hear me?
Yes, I can hear you now.
Okay. So the private sector can provide financial support that includes supporting community-based programs that promote education and prevention, funding public-private partnerships that support NTD elimination, just like we're doing with the NFON, and also investing in research development of new drugs and vaccines. So at IHS, we've been in partnership with NFON since 2021, and it's still ongoing, and I don't think we're going to stop. So another point is building capacity of the Nigerian government and other stakeholders to implement NTD elimination programs effectively. And this can include providing training and technical assistance to health workers, sharing best practices and lessons learned, and providing resources to support these program implementations. So that also injects sustainability into it. So far we have contributed to, training of hundreds of community health workers, as well as administering medicines to people affected by NTDs. Thus, by working with the right partners, NFON and their partners, we're ensuring that the proper dosage is administered and the medicines are effectively utilized. Another key point which Dr. Franca and others also raised is awareness. So before this, I knew about some of these diseases, but I didn't even know they were neglected or anything. And that's me, I read. So imagine the next person that is not aware. So because of this, I challenge everyone, just like Dr. Franca did, to raise awareness. So looking at the private sector, we can help raise awareness of these NTDs and their impact in our communities. And this can include marketing and communication channels to promote education and prevention efforts, and engaging in public-private partnerships to raise awareness of these NTD elimination efforts. So on our part, internally through internal comms, we disseminate to staff, externally through behavioral change campaign communication programs. Creating awareness generally really is a crucial component towards tackling these diseases. Then lastly, we need to advocate for policy development and change, right? Whether it's at the local, national, and international levels to support NTD elimination efforts. This can include engaging with policymakers, other stakeholders to promote policies that support NTD elimination, and using advocacy campaigns to raise awareness on not just the importance of NTD elimination as we're doing today, but how we can also impact the community. So we keep mentioning the private sector, governments, but then it also has to start with us. So in a nutshell, these are some ways, and like I mentioned, I listened into everyone. I took the balcony approach. So based on this, let's challenge ourselves, because I remember a quote by Martin Luther King Jr. The true test of a man is not where he stands in terms of comfort and convenience, but where you stand in terms of challenge and controversy. So let's do our bit and let it start now. Thank you.
Thank you very much, Asmao and other panelists. And we have come to the end of the panel discussion. We will progress to the question and answer session quickly before we wrap off with the closing remarks from Oyetola Oduyemi from the N Fund. So the floor is open to anyone that wants to send in a question via the chat box or unmute his or herself to ask or comment about the discussion. But we have the very first question of the day from Adejunwon Akin. And I think this question should be directed to Dr. Akpan. And it says, what is the National NTD Office doing to key into the Basic Health Care Provisions Fund of the federal government to include NTDs as part of the health services supported by the scheme? So Dr. Akpan, do you quickly want to respond to that in 1 minute, please?
Thank you so much to the questioner. Currently, government is working on that. We've been having some meeting. I wouldn't want to preempt anything or speak the mind of government on this. I want the questioner to have a little patience and see the outcome of what the government is working towards accepting technology and other innovative practices that can boost the strength of government toward elimination of NTD. So we have a meeting on that, and I want him to exercise the patience. The outcome of that meeting will soon be made public, because the target of government of the day is how do we eliminate this disease, especially the 5-PC NTD, before 2030. And our plan is to ensure that we involve every sector, bring in new innovative practices. You can hear when I was talking about research to be more and more. So government is already streamlining. We've been having discussion around this, and the result will soon come out. It will be well and clearly publicized, and things will be done toward improving management and sustainability of NTD in Nigeria. So the questioner, you're on the right track. Government is working toward this. Keep abreast. You'll soon hear from it, from the NTD program.
Thank you very much, Dr. Akpan, for that response. And we have 2 more questions. We still encourage more persons to send in their questions or to unmute themselves and comment on the entire session. The next question is, institutional capacity to implement technology and innovation is important. What is the plan of government to own and implement new technologies? I know Dr. Elasan spoke about technological pathways for eliminating the NTDs, but this particular question is directed at government. So Dr. Akpan, you are welcome to please respond to this again.
Thank you so much. Especially in STH program, I want to ask this, inform the speaker. Currently on STH program, we welcome more and more innovative practices. A lot of technologies have been put in place. Currently, we are aware of in Nigeria not have been able to develop a stethoscope for diagnosis of cysticercosis in the country. That is a very good technology. That is a welcome innovative practices that we want. We really want more, but then not because the country wants more, then we accept anything anyhow that is substandard. It has to pass through a lot of process to ensure that what you are bringing in as an innovative practices, what you are bringing as a modern technology to assist the government in scaling up of all these diseases in the country must meet up with the WHO standards. So we welcome innovative practices. we welcome technologies, we welcome a lot of partners, we welcome a lot to be on board to assist the government toward elimination of NTD, but it must meet up with government standard based on work classification. So we will not accept anything below or substandard. So for now, that is why we said we still need to do more on research, because we look at it that Nigeria have all what it takes by now to eliminate tropical disease in the country. And you knew quite well that if you eliminate NTDs in Nigeria, you are more or less eliminating NTD in Africa. So God is our work. From the private sector, in all innovative practices, we want to eliminate NTD in Nigeria. So all those innovative practices, all those modern technologies are highly welcome, but it must meet the criteria of government.
Thank you very much, Dr. Akpan. We have another question here, but before I read out the question, I would also like to remind the attendees that Professor Moses Bukhari, who gave the keynote address, is still on the call. And if you have questions from his address that you want to direct at him, please do not hesitate to shoot. So the next question is by the same person, Adejuwon Akinloye. Some years back, there was a workshop held in Akure on the inclusion of CDTI strategy into the curriculum of medical schools in Nigeria. Different professors from different medical schools in Nigeria were in attendance. But since then, nothing has been heard about the outcome of the workshop. My question now is, have we jettisoned that approach? Anyone can respond to this, Dr. Akpan, Dr. Franca, or Dr. Elizabeth, or Dr. Fabian, anyone knowledgeable about the CDTI approach?
Thank you. If I can, is that okay? Ebuka, can I respond?
Yes, please.
Okay, thank you. Okay, thank you. I think that's from Adejuwon. Yes, I know that there was a time during the epoch days that the CDTI was brought up, and everybody felt there was need to put it into the curriculum, our education curriculum, and that has been sorted. And I think at this stage is the schools, the institutions that participated to take this on, because epoch did a good work, they were called in and all of that. So if a curriculum is developed and is not being used, I think that is where we need to, check what happened. But we all agreed, Federal Ministry of Health supported, and we all went ahead, and that curriculum was developed and disseminated. So it would be good to check. I believe at the state level or at the federal level, can check and know why that is not implemented and make sure it is done. Thank you.
Thank you very much, Dr. Franca. So we have two more questions. One from Ote Emomo Timi. Apologies if I didn't get that right. And he or she says, what has the government put in place to fast track the clearance of NTD medicine upon arrival at the port? This is also coming from the conversations that were had during the panel discussion. So Dr. Akpan, please, can you respond to this? And perhaps I might just want to add that another question is also thrown at you that says, why?
Yes.
Hello?
Please go ahead. I'm
Okay.
hearing, go ahead.
Yeah, so the second question says the matter of awareness is key, as has been initiated by the panelists. Can Dr. Akpan respond to why there's no deliberate effort by government to create awareness on a national scale, like we have for immunization and malaria? Perhaps it's a relative question based on, okay. It's not like there's no awareness, but based on what we see from immunization, malaria, why don't we have the same for NTDs? So over to you, the two questions, Dr. Akpan.
Thank you so much, the questioner. Let me start from the second question to the first. That's the last one. When there was issue of a guinea worm eradication in Nigeria, the awareness of malaria, TB, and HIV was in the trend. Only guinea worm was making noise then. Now it comes to a point that malaria, TB, and HIV become a household name. As far as public health is concerned, more attention was focused. There was a time that HIV was more announced in the country, that everybody becomes so aware, so crazy about it, so cautious. It was there. There was a time Ebola came, more and more. COVID-19 came, more and more. Now, the time has come also that we should also do the same. Now, when I arrived at NTD, there was no unit called ACSM unit, that is African Social Mobilization and Communication. We have to create that department, we have to create that unit to really work together with health promotion to see whether we can create more awareness. Awareness is ongoing now on radio, awareness is ongoing in television. We have a program with AIT, we have a program with the FM, Capital FM and some other stations. If you get to Akwa Ibom State, almost all the radio stations in that state have an awareness program. If you get to Lagos State, they have it. So awareness is ongoing. The only challenge that we're having is that we are not investing more and more. So we want to see how we can step down that awareness to the grassroots this time around, so that every nooks and crannies of this country, every communities should be aware. So only what we have to do is to intensify effort and more on awareness. Not that the awareness is not there, but we need to do more. And that's why we are calling on all sectors to be involved, especially the private sector also, to see how we can create more awareness. More on-demand migration sensitization is the key issue. Once people are aware of NTD, then you can be rest assured that government problem is solved in terms of managing this disease at least 20 or 40%. So we really need to do more. Just like the speaker has been speaking, we are aware that we need more. The challenge that we're having in the past is that government was focusing much on what gives them a problem at the initial stage. Much was given to the other 3 diseases. Now we need also to give more to that. So it's a question of government interest or prioritizing what is really affected them at hand before they can think of. Today we are aware that NTD is giving a problem, so we need to do more. So awareness has been ongoing. The only thing that we need to do is to increase that awareness, which is the key thing that we are trying to do now. Then coming back to the issue of drugs, we knew quite well that the only thing Nigerian government owe in terms of drug is that it's being given to us free. And your donor decided to give you when it pleases him to give you. We don't have a control over this. That's one. The area that we have a control is to give IDEC and immediately give waiver. That is the only thing. So sometimes this person can arrive the country. He may not arrive with the declaring documents the same time. It will still take us time to wait until those things arrive. There are a lot of bureaucracy involved when it comes to issue of medicines. It's beyond the government of Nigeria to control, because we are at the mercy of the donor. But what is within the reach of the government does not delay. I can assure you that our NAFDAC have been given an ultimatum to ensure that as soon as the medicine arrives the country, IDEC and waiver should be issued. The minister did that and is approved by government. So we don't really delay on that much. But most times, the donor and the clearing agents give us a little headache. Now, effort has been making, we have been putting up effort. That is why the minister recently set up a committee to look into this. And I can assure you, with the coming of this committee on board, which we are going to inaugurate within the month of March, or May or June, these things will be put to an end. We'll be able to reduce the burden of when is the medicine going to be available, why is it not being cleared, and what is all this? So we are working to ensure that we address that challenge. Within a short time, we will have medicine and we'll be having enough. The problem of when is it coming, how is it going to get to the state, and so on and so forth, the committee is going to address that. So be rest assured, and thank you.
Thank you very much, Dr. Akpan. I see one last question, but I know that Dr. Franca is responding to it, so I will let that pass. And to wrap up the event today, I would like to call on Oyetola Oduyemi, Senior Director, Public Affairs at the End Fund, to give closing remarks.
and investing in NTD elimination in Nigeria. We trust that the information and ideas that have been shared have been beneficial and have provided a deeper understanding of the importance of investing in NTD elimination in Nigeria. The discussions today have emphasized the need for collaborative efforts and sustainable funding to achieve the elimination of NTDs in Nigeria. We have heard from experts on the panel who have shared their experiences and highlighted the progress made so far, as well as the challenges and opportunities that lie ahead. We continue to celebrate momentous strides in the journey to ending NTDs as public health concerns, some of which we've heard on this call today. However, a lot more work needs to be done for us to effectively end the suffering and neglect caused by the NTDs. With over 70% of Nigerians still in need of treatment for one or more of these diseases, there is definitely scope for significant progress. As we have heard, the cost-benefit analysis case is clear. The Nigerian economy will reap up to $18.9 billion from increased productivity if NTD elimination is achieved by 2030, in line with the World Health Organization NTD roadmap and also the United Nations Sustainable Development Goals 2030. This is in addition to other benefits, and I encourage you to read the Deloitte report if you have not already done so. We have also heard from the panelists here today what we need to focus on in order to reap these benefits. So the benefits have been made clear, and we're learned, what the cost and what the challenge is and what needs to be done for us to achieve these benefits. And so we hope that this engagement today will lead to growth in the community of public and private sector champions who are passionate about and dedicated to fighting the most prevalent NTDs in Nigeria, so that together we can end these diseases for good. By working together, we can ensure that no one is left behind, that we can co-create the sustainable, equitable, and empowering future that we all envision, and that we can achieve our goal of a healthier and more prosperous Nigeria. Once again, thank you for joining us today, and we look forward to continued collaboration towards the elimination of neglected tropical diseases in Nigeria. Thank you.
So thank you very much, Oyetola, for that. And thank you to my distinguished panelists. Thank you, Professor Moses Bokari, Dr. Nselbong Akpan, Professor Fabian, Dr. El Hassan, Dr. Elise, Dr. Franca, and Asmao. And thank you also for our host, Bernard Oji. And thank you to the attendees. We had a good number of persons join the session, and we hope to continue the conversation so it doesn't end here. Remember Dr. Franca's challenge. Please communicate the NTDs, create awareness on the NTDs, and I hope that in the coming years, Nigeria will do much more in addressing NTDs and eliminating NTDs. Thank you very much, and we apologize for taking 5 more minutes of your time.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you very
Have a
much.
great day.
Thank you.
Thank you very
Thank you,
much.
everyone.
Bye.
Piece of shit.